Hello, my name is Keesha Charles. I am a licensed clinical social worker with Charles Community Counseling Center, and this is Keesha's Corner. All right, so you are back, which means you wanted to hear some more about the mental health disorders. And remember, I said it is a disorder when it impairs your social and occupational functioning. But I wanted to kind of go on a more extreme end, schizophrenia. Okay, so with schizophrenia, it is a mental health disorder, and this lovely book, the Diagnostic and Statistical Manual of Mental Health Disorders. So many of us have probably experienced someone that you see, say, standing on the corner talking to themselves, or that say they hear voices, not their own voice or your own thoughts, but a distinct other voice. So that's auditory hallucinations. You may have someone that experience visual hallucinations, seeing and hearing things that are not there. Then you have individuals that may feel things that's not there, something crawling all over them. Okay, so any type of hallucination, seeing, hearing, smelling, feeling things that's not there. So you notice all these impact your senses. Okay, now there's different levels of schizophrenia. There's a schizophrenia spectrum. Okay, so I'm gonna go on the most severe end because this is the length of time is what changes the diagnosis. Okay, but the symptoms for schizophrenia: delusions. Delusions, I explain what hallucinations are. Hallucinations is seeing, hearing, feeling things, something that deals with your senses that's not there. A delusion is a false belief, okay? Believing something that is absolutely not true, okay? Like you feel like you pregnant, I had someone that was pregnant for 7 years, okay? So if you're having a false belief, whatever that is, aliens are invading your brain. You see the movies and stuff with people with tinfoil blocking their windows with tinfoil because people are reading their brains. That's a false belief. That's not a hallucination. Okay. So 2 or more of the following symptoms for a significant portion of time: delusions, hallucinations, disorganized speech, that's frequent derailment or incoherent speech, grossly disorganized or catatonic behavior. Okay, negative symptoms, that means diminished emotional expressions. They have no emotional expression, flat affect. Okay, now a significant portion of this time spent since the onset is that it impacts their level of functioning in major work areas: work, their interpersonal relationships, even the ability to care for themselves. Like for an individual with like this that's experiencing some of these symptoms, they have marked disturbances, sometimes even requiring a hospitalization. They may have to take a medication like an antipsychotic. We teach them how to manage the symptoms. Okay, for a person that may be taking a medication because of, say, a hallucination, many of the individuals I've worked with, they say the voices never really go away. It is lower as opposed to screaming or loud, and they can't hear you talking because the voices, or they can't see you because of this person that they see or thing that they see. So we teach them how to manage those symptoms and distinguish reality versus the hallucination or the delusion. Are these things matching up to reality? Talking to someone, having a support person is a major, major deal, because that's a person that you trust, that you can talk to help you distinguish reality versus hallucinations or your delusions. Okay, and are you seeing what I'm seeing over there type thing? Okay, but this is someone that's also not going to make fun of you because of the condition that you may have. All right, so remember I mentioned there's schizophrenia spectrum. That's more on the severe end. Okay, 6 months, 6 months or more for schizophrenia, full-blown schizophrenia. If it's something like 1 day to 1 month experiencing these symptoms, it's just a brief psychotic disorder. It crosses the line at 30 days and becomes schizophreniform. Okay, that 1 month through major depressive, I'm not going to say major depressive disorder, schizophrenia, which is the full-blown symptoms that last a long time. So then that person, like I said, may need some type of medication to help with the psychotic features. but those features may never truly go away. It may diminish the voices. It may help them clear some things out. Their head may be in a like a fog, okay, and can't see clearly because everything that's going on around them in their head. So having that support person helps. The therapist can also help them look for cues to distinguish between reality and delusion or hallucination, okay? I taught one person as far as something as simple as the weather, not knowing when to dress appropriately. Because remember, I mentioned too, grossly disorganized, all right? That may mean not knowing how to function with day-to-day things, okay? So not knowing how to dress appropriately for the weather. So wintertime, we wear coats, we wear hats, gloves, or whatever to kind of keep ourselves warm. But as a person is transitioning to summertime, they may not know to take those things off and wear lighter clothing so you don't pass out. So teaching that person to also pay attention to other people they see, looking out their window if there's a lot of traffic of people moving around about the street, what they have on. Checking the weather every day to see, okay, has the temperature dropped? If it's at this temperature, I wear this. If it's at this temperature, I wear that. Because it doesn't register to them if they walk outside, or for this particular individual years and years ago, register to walk outside. Oh, it's cold. Let me put a coat on. Okay. It may not register to that person. So be kind to those individuals, and we also have to determine too, when a person shows up into our emergency room, or our clinic setting, and they're experiencing these symptoms, sometimes we do have, all the time, we have to ask ourselves, is this person experiencing a psychotic episode because of, say, schizophrenia or brief psychotic disorder, what have you, or if it's a medical condition, okay? I worked in dialysis for years, okay, as a social worker, okay? So an individual who misses dialysis treatments for an extreme period of time, it can be just a week. Toxins are building up in your body. The purpose of dialysis is to clean the toxins out your body and reduce the excess fluid in your body. But a person who has toxins that build up in their body, that can actually trigger what seems to be a psychotic episode. The person may start having delusions. The person may start having hallucinations, not because they have schizophrenia or brief psychotic disorder or whatever. It's toxins, okay? So Lyme disease, there are so many different things out there that can trigger it. What about drug use? Okay, if a person is on a, tripping out on a psychotic medication or psychotic drug out there, a street drug, it may trigger or mimic somebody with schizophrenia, but it's a drug-induced psychosis. So we have to ask, what came first, the chicken or the egg? Is the person experiencing psychosis because of a medical condition, because of drug-induced or whatever? Or if the person who is experiencing hallucinations and they're trying to diminish the voices, so they use drugs to block out the voices. There is a difference. What came first, the chicken or the egg? I talk to these individuals. Sometimes it's hard if they're just like so over the top, maybe psychotic, and we have to try to stabilize them. And then to be able to get a good history, having collateral people, family members, friends, or just individuals that know them, who know their baseline and what it's like. I've seen individuals having, in a medical condition, toxins built up in their body. They may have gotten bitten by something and they mimic somebody that was having, say full-blown schizophrenia or whatever, but they had no history. I was able to intervene once before with a doctor who thought a patient was having a psychotic episode, but I knew that individual because I had worked with that individual a long time before, and I happened to be passing by during a conversation. And I'm like, no, this is not the baseline for this individual, so that's when appropriate tests were run, to verify there was a toxin that had built up in the body that caused a psychotic episode, or what appeared to be a psychotic episode. Catatonic state, couldn't talk to speak for themselves. So family members is so important when gathering history so we can know how to appropriately treat that person. In a previous video, I talked about bipolar disorder, those ups and downs. Sometimes during an extreme high or even extreme low, a person may experience hallucinations, delusions, okay? So that might be bipolar disorder with psychotic features. But when that person reaches their baseline, those psychotic features should go away. If they don't go away, then that person has schizoaffective disorder. That's when you hear people saying, oh, I've had individuals, I have bipolar and schizophrenia, because they're having those ups and downs, but they're also having psychosis as well, even at their baseline. So we have to treat both. You have to know how to treat both, because if you have bipolar disorder and you having symptoms of schizophrenia, but you only treat one or the other, that person is, you setting them up for failure. So adequately give history to your doctors. Ask the questions if you are the therapist or the mental health professional or the medical professional. Ask the questions so we can get an adequate diagnosis for that individual, so we can adequately treat them and know how to treat them. And I get it. We can only treat what's presented to us. Okay? And so sometimes we got to dig a little deeper. And it's over a few sessions we get more information and like, oh, okay, this is not quite what I thought it was. But there is a difference. So schizophrenia, you having these delusions, these hallucinations, disorganization, and then daily living is impacting your daily functioning as well. Back to that social and occupational functioning, right? And then it's the mood. If the mood is included with that, even at baseline, then we have schizoaffective disorder, which is kind of a combination of bipolar and schizophrenia. So both have to be treated, the mood and the psychosis. All right, so this was brief, as in a brief psychotic disorder. All right, no pun intended. But anyway, so I just wanted to give you some brief information about the schizophrenia spectrum and the different levels based on time, based on symptoms that's going on, and also determining what came first, the chicken or the egg. Is the person having psychosis because of an issue that's going on with them medically or drug induced, or if it's that glitch I talked about before, okay? All right, thank you. I'm glad you came back. Don't forget to come back for more, because I will continue this series as we are ending Mental Health Awareness Month, because I want to break the stigma. Stay tuned for some tips on how to get help. Whether you have insurance, contact your insurance company to see who's in network with your provider, reduce your out-of-pocket costs. If you don't have insurance, there are free resources available to you that you might be able to seek help with. The most of the information I post is for the area that I reside in, or the state. And if you're in a different state watching this, which I have found some people are, then check your local listings as well to see where you can get help for this. All right. Thank you and have a blessed day. Bye.